Good evening, I'm Asha Tomlinson. Andrew and Adrian are away. Tonight, the exponential rise of Omicron.
The virus is all around us. It's very much a threat. We have to keep our guard up.
Broken case records in 6 provinces, new restrictions in others, as the variant surges across the country. Plus, help is on the way for workers and businesses taking another hit. Is it enough?
It's going to be hard to calculate until we're kind of assess the damage at the end of all of this when the dust settles.
Weighing the highs and lows of an historic year in space with Bob McDonald, including what he's worried about in the years to come.
If you're going to put something up in space, you should also be responsible for bringing it back down.
And a pandemic project to create some Christmas magic.
Thanks to the community, my kids are going to have a great Christmas.
This is The National. We know more now about what Omicron is capable of. This is already the biggest wave of COVID infections yet, with no sign of slowing down. But it's clear officials, all the way up to the Prime Minister, are also worried about the next shoe to drop.
We need to prevent Omicron from overwhelming our healthcare systems.
Doctors and nurses across the country are exhausted. Some have quit altogether, and the ones that remain are bracing for the worst. Seeing average daily new cases climb like this is chilling. From less than 5,000 just a week ago to more than 10,000 today. An explosion so sudden, it's impossible to know at this point how it will impact hospitalizations. They've barely budged so far, but hospital admissions can lag behind COVID case numbers by 10 days or more. So efforts are focused on containing contagion. Marina von Stackelberg follows the orders and pleas to get Canadians to cut back on contacts and hold the line as the Omicron wave keeps crashing in.
To even get a COVID test in Montreal means hours of waiting, wrapped around city blocks, as Quebec broke another record. More than 6,000 new COVID-19 cases. The Premier says by morning, expect 9,000 more.
We're keeping the limit of 10 people for Christmas, but I ask you to please cancel your Christmas parties if you can.
As of Boxing Day, private gathering limits in Quebec dropped to 6. Case records have also been shattered from BC in the west to all of Atlantic Canada, save Newfoundland and Labrador. The virus reaching across the country and up to the Prime Minister's staff. 3 aides and 3 of his security detail have all tested positive.
They're following all public health guidance. So am I, and so must we all. But it's a reminder that the virus is all around us. It's very much a threat. We have to keep our guard up.
Trudeau has tested negative. He isn't isolating, but is doing regular rapid antigen tests. His government sent more than 35 million of them to provinces and territories this month. Tens of millions more will be arriving, but not until the new year. There aren't enough to go around.
I was in line here by 5 o'clock.
Rapid tests won't be given out at Toronto's Union Station anymore because of the crowds they drew.
We have 1,000 tests, 1,000 people pretty quickly before we ever even begin to give them out.
For the second day at an Ottawa community centre, people lined up for hours.
So we stood in here for 4 hours waiting to get this. I'm not sure if it's worth it. I don't know. Hopefully it will be.
Long praised for its easy access to rapid tests, Nova Scotia will start restricting who can get one next week as cases skyrocket. It's also halved capacities in restaurants, stores, and homes. Newfoundland and Labrador closing bars and theatres.
Our fear is that if we start to see severe illness, it will overwhelm our healthcare system, which is already stretched.
As visitors to PEI now need to self-isolate for at least 4 days. Outbreaks have been declared at Charlottetown's hospital and a long-term care home. The Manitoba government will give out KN95 masks at Winnipeg liquor stores. That province is delaying the return to school for a few extra days.
It's probably more necessary now than ever.
Marina, do we know anything about how provinces are preparing hospitals for this wave?
Well, there are concerns about a staffing crunch as these Omicron cases rise, with people having to call in sick or self-isolate. And so the Ontario government is recommending that hospital staff still come to work even if they've been exposed to a close contact. They have to have no symptoms and test negative every day for 10 days. Asha.
Okay, thank you, Marina. And with all this uncertainty, the federal government announced more financial help today by temporarily expanding access to pandemic support programs previously limited only to workers out of a job because of a full lockdown.
If you have lost 50% or more of your income, you can qualify for the Canada Worker Lockdown Benefit. This benefit will put $300 a week in your pocket.
There's also help for business owners who have to limit their capacity to 50% or more. All told, there's some $4 billion in federal dollars on the table, with some provinces announcing more help of their own today, too. Here's Jacqueline Hansen with what's on offer and how Canadians are reacting.
At 50% capacity, the math doesn't make sense for this Windsor salon.
We can't afford not to work, and yet we also can't afford to stay open.
The new restrictions came into effect in Ontario Sunday morning, but it took days for the province to promise affected businesses help, coming next month, in the form of energy and property tax rebates and deferrals for some provincial tax payments.
When you find out that the government's really giving us less than the bare minimum, it feels like a smack in the face.
In Manitoba, businesses forced to limit capacity can apply for grants between $3,000 and $12,000, depending on the number of employees they have.
I struggle to think of any small restaurant or bar that employs, 9 people or under that $3,000 one time is going to be, adequate.
The owner of this Winnipeg wine bar and tasting room worries the restrictions will outlast the money.
It's going to be hard to calculate until we're kind of assess the damage at the end of all of this.
Head west and there's more concern about damage being done. As of tonight, all BC gyms have to close, along with dance studios, bars and nightclubs.
The fitness industry is continuing to reel in shock.
The province says support for businesses is coming, and the expansion of the federal rent and wage subsidies to include businesses and workers facing capacity restrictions, not just lockdowns, should mean relief for many across the country.
Any type of grant or subsidy is helpful at this point. I think that time is of the essence.
Each offer of help also means more time and energy on applications and paperwork for business owners who are already exhausted.
Everyone I know in this industry is fighters, and I'm going to hope that we're going to come through this. But it's scary.
Trying to manage the anxiety of clients, employees, and their own. Jacqueline Hansen, CBC News, Toronto.
At least 30 employees with Ottawa's paramedic service have tested positive for COVID-19 following a private gathering last week.
I found the news to be extremely disappointing and frustrating. The speed and ease at which this virus spread through the paramedic service shows just how tenacious and damaging the virus could be.
130 staff are said to have attended the gathering and are now considered high-risk contacts. And nearly 100 patients have also been identified as close contacts. It's not clear if any patients have tested positive. Liberal MP Yves Robillard has been removed from his parliamentary committee duties for taking an international trip over this Christmas break. The Liberal Party says it does not consider the trip he took to be essential. In what could be some good news in the fight against COVID, the U.S. Food and Drug Administration has cleared an antiviral drug for emergency use, the first take-home pill approved for COVID-19.
The very good news is that we have a product now that has about a 90% efficacy in preventing hospitalization.
It's developed by Pfizer and authorized for Americans aged 12 and up who have conditions that raise the risk of serious illness. Lab and trial data suggests it can stop severe COVID and should be effective against Omicron. Health Canada says it's reviewing Pfizer's submission, but it's still waiting on more data. The pill will take some time to mass produce, but let's get a sense of how big a deal this really is with infectious diseases specialist Dr. Lisa Barrett. Dr. Barrett, first of all, how significant is this approval of the COVID treatment pill?
Well, given that we have Omicron circulating and it's very transmittable, and we're worried about hospitalizations, any tool we get that prevents hospitalization, like this particular oral medication, is a good thing. So this is a very good addition to our COVID treatment and prevention of severe disease toolbox.
And I wanted you to weigh in on another bit of research emerging today that could be good news. New data from South Africa and Scotland suggesting Omicron is less severe. What are we learning, and should we stay cautious?
Definitely stay cautious, but optimistic would be my thought. There are certain caveats to that data. They're early data, and not all countries' data are actually showing exactly the same thing. But even if we have a certain amount of decrease in our severity and hospitalization with Omicron, one, people still get sick, and two, we've still got to find ways to make sure we spread out these infections to protect our healthcare system because it's very transmittable. So we need to take that data with a good bit of caution.
So silver lining, but still take all necessary precautions. All right, thank you so much, Dr. Barrett.
Thank you.
As the pandemic grinds on, there has been a troubling rise in personal attacks on Canadian healthcare workers, public officials, and politicians. But an Ontario doctor is pushing back after being subjected to a threatening online harassment campaign. Cameron McIntosh explains.
Protests at the front door of Ontario's premier, also at the home of the provincial health minister. On Prince Edward Island, same thing, on the front lawn of the chief public health officer. And for Dr. Nathan Stahl, a bounty posted on Twitter by the publisher of a website that opposes COVID restrictions.
Bounty is clearly a term that's used historically to basically come for somebody's head with a reward on it.
$5,000 to anyone catching Stahl and a colleague on video breaking COVID rules.
This type of psychological abuse and threats is a well-known, intimidation tactic. So I take it seriously.
Across the country, healthcare professionals, public officials, and politicians are increasingly becoming targets.
57% of physicians experience mistreatment over the last month alone.
Doctors Manitoba found it's not just the vocal and visible anti-vaccine or anti-science movement. It's also people frustrated over access to vaccines, long wait lists, and pandemic fatigue.
We heard about incidents involving yelling, name-calling, threatening letters being delivered to physicians' homes.
Recent federal legislation makes it an offense to intimidate healthcare workers on the job. The Canadian Medical Association calls it a good start.
We also hope that we can reclaim what I think defines us as Canadians, which is caring for each other.
Stahl is running for the Liberals in Ontario's election next year, says people of all political stripes must condemn these acts.
Get off of people's front yards and leave them and their families alone.
But many in medicine fear it will only get worse, leaving less room for legitimate discussion, debate, and disagreement. Cameron McIntosh, CBC News, Winnipeg.
In the UK, the rise of Omicron broke another record today. And with no sign of stopping, sick calls and isolation requirements are putting a staffing crunch on some key industries. Here's Farah Morali.
The bright lights on London's Regent Street. A stark contrast to the dark COVID-19 picture that's emerging today. The UK has topped 100,000 daily new cases for the first time ever.
It is worrying, but from what I hear, people aren't as affected as badly, but definitely more cautious.
I feel like we have to learn to live with the virus. We can't really look at the numbers anymore because they're always going to get higher.
Despite the surging numbers, England is not imposing any new restrictions before Christmas. The government says it's still reviewing the data on Omicron. And while Wales, Scotland, and Northern Ireland have all moved to impose a host of new restrictions after Christmas, including curbs to bar service, nothing new officially has been announced in England, at least not yet.
We can't rule out any further measures after Christmas, and we're going to keep a constant eye on the data.
As the number of people infected with the virus spikes rapidly, it's forced many across the country to call in sick. Today, the government announced a change to a key policy, shortening the isolation period for those who test positive from 10 to 7 days if they're double vaccinated and test negative twice. It's a move the government says will minimize disruption.
Staff shortages have prompted mass cancellation of trains on UK rail lines, and it's impacting the healthcare system too.
I'm fine. I had very mild symptoms.
Dr. Sonia Adesara is in isolation after testing positive.
Yes, a lot of health workers have been catching COVID, like myself, and a few of my colleagues are currently off because we're having to isolate. So it is a problem because, of course, health workers and also other important workers, whether that's sort of transport drivers, people working in our shops, people working in deliveries.
Back on Regent Street, some shoppers hold on to a glimmer of hope for a somewhat normal Christmas. It's what comes after that that's unclear. Farah Morali, CBC News, London.
We want to change gears from the COVID story for a minute. Tonight, people in a tight-knit Nova Scotia community are trying to make sense of the senseless. An 8-year-old boy was shot and killed yesterday in Dartmouth. And as Tom Murphy explains, police believe it was not a random incident.
They say Lee Marion Kane loved to surf, loved life. As an 8-year-old, he certainly seemed to enjoy a good suit. Each summer, his community of North Preston crowns a king and queen. This year, the young boy who went by Marmar took the crown.
And he died, King Marmar Kane. He died being our king of North Preston. The whole community is not good. And I feel personally that it's a nightmare waking up and then to see that this was something that actually happened.
Kane's shooting death is as tragic as it was brazen. It happened here on a busy street during rush hour. Kane was in a vehicle with a 26-year-old man who was also shot from another vehicle, but is now recovering. Police are calling this a homicide and are looking for suspects.
At this point, we haven't made any arrests, but we are diligently working every avenue to move the investigation forward.
Last night, the mayor of Halifax tweeted, "This is senseless and heartbreaking." Police say they don't believe the shooting was random and will not comment on whether the homicide is related to an earlier murder last week in Dartmouth.
And that's certainly one thing we would explore, what the connections are to other incidents.
I am a strong supporter in the community against gun violence, and I always advocate to these young guys. They're going to keep shooting until somebody innocent get hit, and now it happened. And it's so sad that it had to be Marmar.
His cousin says Marmar Kane's Christmas gifts were already under the tree.
And I'm just feeling sorry for them Christmas morning to know that that one section is probably going to be left there. It's going to be hard for her to remove that.
Police are promising to get more information to the public as soon as they have it, as a family and wider community are now left to grieve during what is supposed to be a joyous time of year. Tom Murphy, CBC News, Halifax.
An update on our story last night about the NHL's plans to skip the Winter Olympics. It's now official. The league will not send players to Beijing.
In my opinion, a smart decision. I mean, I don't know who would really want to go under those circumstances.
In a statement, the NHL said, given the profound disruption caused by COVID-related events, Olympic participation is no longer feasible. With more than 15% of players sidelined, the NHL season is on hold until at least December 27th. COVID cases among the Toronto Raptors have forced a postponement of tonight's game against the Chicago Bulls after Toronto couldn't field enough players. At least 8 Raptors are now in the NBA's health and safety protocols. This is the 3rd time Toronto has had to reschedule a game this season. In the U.S., Joe Biden is declaring victory over the pandemic-fueled supply chain problems that have plagued retailers and shoppers. Just in time for Christmas. But what does it mean for those waiting for goods on this side of the border? Here's Katie Nicholson.
From the West Coast to the East, global supply chain issues prompted by the pandemic choked ports with container ships waiting to be unloaded.
We're still catching up as a nation to what happened a year and a half ago when Asia shut down.
The pain is real for retailers. Auto dealers struggling to get new cars on the road, furniture vendors with half-empty warehouses, even liquor stores having a hard time keeping their shelves stocked.
There's a shortage in glass, there's a shortage in cork, there's a shortage in all the materials necessary for bottling.
But the supply chain is catching up, says the U.S. president.
Right now, the number of containers moving through our ports is higher than ever.
After new investments in ports and rails and slashing red tape to get more truckers on the road, Joe Biden is confident the U.S. supply chain will soon be running at pre-pandemic capacity. So what does that mean for Canada?
After 3 months and countless phone calls, our store has finally arrived.
Ali Ulku doesn't just study the supply chain, he's been affected by it too, waiting for months for this stove to arrive from New Jersey.
Any improvement in supply chains in the United States will definitely impact our supply chains in Canada.
But there's a caveat. Canadian logistics companies have to be ready for the increased flow of goods.
It will not mean much if the goods that are destined to come to Canada are sitting at the borders.
COVID isn't the only thing causing supply chain issues of late. The BC floods, which clogged the port of Vancouver, now being blamed for a French fry shortage in Japan. Evidence that both Canada and the U.S. don't need to just pandemic-proof the supply chain. They need to climate change-proof it as well. Katie Nicholson, CBC News, Washington.
Given how contagious Omicron is, experts say wearing the right mask is more important than ever. Would you use this, Dr. Park?
No, I would not use it.
Our marketplace investigation put masks to the test. Who failed? What you need to know before you buy. Plus, making a sweet holiday tradition more accessible.
Everybody else can see and grab the ones they want, except me.
And after a busy year in space exploration, Bob McDonald is here to tackle it all.
This is my space shirt. You like it?
This is my space tie. We kind of match.
We're back in 2. Welcome back. Chances are there will be a lot of chocolates given as gifts over the holidays, many carefully chosen. But this season, one Canadian chocolatier is thinking outside the box to appeal to more customers. As Nisha Patel shows us, it's part of a movement toward inclusive packaging.
Everybody else can see and grab the ones they want, except me.
It may be just a box of chocolates, but for the blind community, it's a taste of independence.
I got it!
So we talked a lot to people who are in the blind community, and they share that they often feel like they're forgotten.
The Purdy's chocolate box features Braille on the outside and a Braille chocolate legend inside.
This is rare to find Braille on a product.
John Ray has been blind for most of his adult life. Without the Braille on this box, he would have to ask a store clerk for help.
We do not like having to rely on others as much as we do.
With 1 in 5 Canadians living with a disability, businesses of all sizes are starting to take inclusive packaging more seriously.
Our new limited edition easy open lid.
Beauty brand Olay changed the packaging of some face creams.
Degree has created the world's first adaptive deodorant.
Degree is testing new packaging featuring a Braille label. It can also be opened with one hand. Christina Mallon helped bring this campaign to life.
My personal goal is to make inclusive design the only way people design.
After becoming paralyzed in both arms 10 years ago, Mallon now works with companies to improve product accessibility.
I do show them the business numbers about how this will increase customer happiness, employee happiness, that will help their bottom line.
Surveys show that adapting packaging to all abilities creates loyal customers. Back in Toronto, Ray says it's just good business.
When something is done to make a building or a product or a program more accessible, allegedly for us, it often helps many others.
And seeing even more inclusive packaging on store shelves permanently would be sweet success. Nisha Patel, CBC News, Toronto.
The official advice for Canadians is to consider upgrading your mask as Omicron spreads. But how can you be sure you're getting what you pay for?
It's really worrying that there's a mask on the market that you can purchase and it fails so badly.
Next, our marketplace investigation reveals not all KN95s pass the test and what to watch out for before you buy. Welcome back. As Omicron continues to spread, there are renewed calls for more protective masking. Maybe you're one of the many people scrambling for a better mask, like a KN95, but not all masks are created equal. So we want to revisit a marketplace investigation that puts masks to the test. Here's what we found. Respirator-style masks have become a preferred choice in this pandemic, designed to filter out 95% of what you breathe in. But do they really offer all that extra protection? To find out, we go shopping for the queen of the mask pack. It's a protective face mask rated to capture 95%. And we find masks labeled KN95. That's China's equivalent to the well-known N95. This one has the FDA logo. Seems pretty legit to me. I'm gonna put this one in the cart. Prices range from less than $1 to $4 a piece. We purchase 14 brands in total from Amazon and some of the big box stores. Then we take them to the University of Toronto's Dalla Lana School of Public Health. James Scott and his team will see if these masks live up to the standards they claim.
What all of these tests do is they subject the mask to an aerosol, so an atmosphere of very fine particles.
And while testing gets underway at U of T, we meet Dr. Jay Park in sunny San Diego, California. Hi, Dr. Park, good to see you.
Hi, how are you? Good to see you too.
He's an emergency room physician. After 3 of his colleagues died of COVID, he turned his focus to vetting respirators.
I just felt like it was my duty to protect my friends.
What he found out was unsettling.
Up to about 90% of what we were getting were either misleading or potentially counterfeit or falsely advertised.
Today, he's telling us which ones to avoid. First red flag, the box. It should include the manufacturer's name and address. It just says KN95 3-dimensional protective respirator. Doesn't even have a brand that I can see on it.
You don't want to buy something and not know who the manufacturer is, for you to be able to trace back and say, okay, this is who made it, and I can look up their registration and certification online.
Everything about it shows that it's official, even on the side, FDA approved. Turns out that's the second red flag. That FDA logo is not allowed.
If it has an FDA logo on the box or on the respirator, then it's definitely not FDA approved, cleared, or authorized.
We'll unpack the final red flag in just a moment. But first, our results are in. And get this, half of the masks we tested failed. And just check out the results for these KN95s we bought off of well.ca, a shopping portal for Rexall pharmacies.
So well.ca did very poorly on our tests, unfortunately.
One of them tested below 60%.
Yeah, it's really worrying that there's a mask on the market that you can purchase that claims this to have met the standard, and it fails so badly.
Well.ca doesn't respond to our results. Instead, they direct us to the manufacturer. We ask repeatedly who that is. They won't tell us, and it's not listed on the box either. Walmart's masks are another fail. They filtered less than 75% of particles. Walmart says they should have never been for sale. They've now removed them, and the other KN95s we flag. A few from Home Depot and Home Hardware test just below the standard. They come in just a percentage point or 2 below, but
a fail is a fail is a fail. I'm a university professor. I have students who take an exam and they don't pass the exam, but maybe they only fail the exam by 1% or 2. And unfortunately, those students still fail the exam.
Despite our results, these retailers say their masks follow regulatory standards. Home Depot adds they're investigating further.
If you're just using this to go shopping or do low-risk activities, then yes, your testing results do show that it protects you better than cloth masks. We don't have to throw them out. I think that you just need to be informed that these do not meet K95, 95% filtration standards.
As for Amazon, 3 did not deliver on their claims, including the Seal Goods brand, which registered as low as 19% filtration. the lowest on our list. It came like this. You can see 2 packages here. This one came in a Ziploc bag. Would you use this, Dr. Park?
No, I would not use it.
That leads us to the final red flag: unmarked, sketchy packaging.
You don't know who the manufacturer is, and you don't know how safely they were packed.
Amazon says they make sure the masks on their site are legit and remove bad actors. We tried reaching out to the sellers. Most have disappeared. One says the masks we bought could be counterfeit. One of the KN95s came back 19% filtration.
Oh boy.
Our expert says you could even wear a towel and it would give you better protection.
Perhaps retailers have to be a bit more careful about where they source this merchandise.
Okay, here's what you can do before you buy masks online. Cut out resellers and buy from companies that sell PPE. Plus, you can check if the mask is authorized by Health Canada and check for counterfeits on the CDC website. When we come back, Bob McDonald is here with the biggest space stories of the year.
If you want to pick on other places where we could find money to take care of the Earth, don't pick on space, because we actually need space.
From the billionaires blasting off to the International Space Station under threat, Bob and Andrew are here right after the break. It's been a big year for space exploration, but also a controversial one, thanks to a renewed urgency to pay attention to the fragile state of our planet. So who better than Bob McDonald, host of CBC Radio's Quirks and Quarks, to guide us through the 4 biggest space stories of the year? What did his expert eye catch that the rest of us may have missed? He sat down with Andrew Chang.
Bob, really nice to see you again.
Good to be back, Andrew.
Really nice shirt, by the way.
This is my space shirt. Right?
This is my space tie.
Hey, we match.
We kind of match. We had Branson, Bezos, Shatner going up. I mean, SpaceX, big in the news. I get, in a way, why it's important, right? Incremental baby steps for mankind. But you tell me, I mean, what's the big deal here?
Well, first of all, I counted 25 tourists went up this year. That's astounding. We've never had that many ordinary people go up into space before. And right now, it's rich people and their toys. I mean, that's what they are. If we can get more people doing it and the price comes down, then more ordinary people can go up and have the William Shatner experience. He broke down in tears when he came back because he saw the atmosphere of the Earth as being very, very thin, a thin line. He went, wow, we all live in that. And there's this thin blue line and then the deadly blackness of space. And he was overwhelmed by that. Well, that's good environmental awareness. And going into space does that. You know, everybody goes up to get what they call the overview effect. So the more people that can do that, the better, as far as I'm concerned. So space tourism right now is where the airline industry was when it first started. Only rich people could fly. More people did it. It becomes a bigger business. More people can have access to space. So we'll see what happens.
When it comes to space tourism, even space exploration, I feel like this year has been a little different from past years, where there's been a lot of blowback, right? A lot of people who've kind of openly wondered this question, okay, you know, the space, the tech is neat, the blast-offs are cool, but aren't there more important earthly pursuits that we ought to be prioritizing, right, and ought to be dealing with? It does feel different, right?
Yes, it does. And you're absolutely right. We should be prioritizing our attention towards the Earth. But in fact, Andrew, that's exactly what space does. It looks at the Earth. You know, back in my day in the 60s when I was watching the moon missions, the very first mission to the moon, Apollo 8 in 1968, they didn't land, they just went around the moon. First time humans left the Earth and went to another heavenly body. And while they were there, they took that famous Earthrise picture, you know, the blue marble above the Earth. Yeah. It is no coincidence to me that after humanity saw itself as one very small little ball, and the guy who took that picture, Bill Andrews, I actually met him. He said, you know, you could hide the Earth behind your thumb from the moon. It's behind your thumb, and all you see is this blackness. Right after that, the Environmental Protection Agency came along, Earth Day came along, Environment Canada came along. People became aware, wow, this is it. There's only one environment. And since then, our space program has sent up satellites that look down on the planet to give us that broad view. And it was satellites that saw the ozone hole. Satellites are weather. Every night, you do the weather. What do you get? You get a satellite view looking at, here's the latest hurricane coming this way. Here's the ocean currents that are shifting. We're watching the ice disappear in the Arctic. That's all happening from above. So the satellites, the space program is giving us a picture on ourselves that we can't get from the ground. And so I think it's vital that we do that. But let me give you another perspective, Andrew, on how much space actually costs us. Here in Canada, if you divide the budget of the Canadian Space Agency to the population of Canada, it's less than $10 per year. $10 per year. You're going to be spending more on Christmas presents than you do on the space agency.
That's true.
So it's not hugely expensive to be up there. If you want to pick on other places where we could find money to take care of the Earth, don't pick on space, because we actually need space.
Whatever happened to the NASA DART mission? This was a mission to, and correct me if I'm wrong, it was to essentially slam something into an asteroid in order to try to change its trajectory.
Right.
Finish the story.
Well, it's on its way. Now, I know there was a movie made up, with Bruce Willis where they go and they blow the thing up.
That's right.
You don't want to do that, because if an asteroid's coming to us and we blow it up, now we got 1,000 asteroids coming at us like buckshot. You don't want that. What you want to do is just nudge it just a little bit, because if you catch it far enough away, the Earth is a pretty small target. So you just nudge it off so that it'll go by us and not hit us. So that's what the DART mission is about. See if we can just nudge an asteroid. Can you do it? Or will it break apart? So it's the first. And asteroids are a real threat.
Not all space hazards are natural. Some are man-made, right? And the International Space Station had a potentially dangerous situation.
We did. The Russians did an anti-satellite test, which should be illegal. And by the way, the Americans have done the same thing, and so have the Chinese. But this one got a lot of publicity because what they do, if there's a satellite in orbit, they send up a missile from the ground and try to hit it, which is very hard to do because satellites are moving fast. They're moving almost 30,000 kilometers an hour. So you're trying to hit a bullet with a bullet, is what they're trying to say. So it's very difficult to do that. So they did. But the problem is that it made all this shrapnel that spread out, and it turned out that the dirt and the pieces that were left are in line with the International Space Station. And so the space station plowed through that stuff. The astronauts on board had to hide. They had to get into their capsules to get ready to leave in case it punctured a hole. Because again, the speeds are so high that even a small piece like that is a bullet. And by the way, the Canadarm that's on the space station right now has a hole in it. One of these pieces of debris actually hit the Canadarm. It didn't hurt it, but you can see there's a big hole in it right now. So that stuff can go right through. It can puncture the module, start air escaping and things like that. We need an international treaty. The spacefaring countries need to get together and make an agreement that we won't do that, and that will clean up the junk. There are more than 10,000 dead satellites orbiting the Earth right now, and they all pose a hazard as well. So if you're going to put something up in space, you should also be responsible for bringing it back down at the end of its life. So far, there are no agreements for that, and we need one.
Can we talk about China? I mean, I remember, for years, most of my life, the ISS, even Mir, were the space stations that I knew of.
Sure.
China was not a player.
Absolutely.
Boy, has that changed.
And it's because the Americans don't want the Chinese to be part of the International Space Station because of political reasons. So China has decided on their own to have their own independent space program. And they've been doing some remarkable things even just this year. They also landed a rover on Mars. And it's driving around, and it had the ability to look underground, so it's doing geology on Mars. They landed a lander on the moon that scooped up some lunar dirt and brought it back to the Earth. We haven't had lunar samples since 1972, when the last astronauts went there. And they've got their own space station. And they've got 3 astronauts up there right now. They call them taikonauts. But they're up on their own space station right now. They've done spacewalks. I was just watching a video. They were doing lessons to school children from space, playing with blobs of water in space and showing how things behave differently in zero gravity. And they have their sights on the moon. So you watch. They're sort of in the background doing their own thing. We don't hear about it much here in the West. But I wouldn't be all too surprised if the next flag to be planted on the moon is a red one.
Because the way things are going, you can't help but wonder if this is kind of a new space race, similar in a way to the ones that we've
Yes,
seen.
and if they announced that they had a mission to the moon, a manned mission to the moon, you can bet that the Americans will be speeding up their plan to get someone there first. So maybe that would be a good thing, push it ahead.
Another space story on our radar tonight. The James Webb Space Telescope is the successor to the Hubble. It's set to launch on Christmas Day with some Canadian ingenuity on board.
Webb will be able to see the formation of the galaxies soon after the Big Bang. It's also going to be able to image and analyze the atmosphere of exoplanets, looking for those telltale signs of life.
Canada's contribution to the project includes a fine guidance sensor, which allows the telescope to point and focus on certain objects. We should see the first images back here on Earth beginning in the new year. Next, going above and beyond to give parents and kids a little extra help this holiday season.
Thanks to the community, my kids are going to have a great Christmas.
The very personal story behind this toy drive in Yellowknife after the break. A toy drive in Yellowknife is bringing some much-needed joy to families in need. As Juanita Taylor explains, for the people behind it, the act of giving to others is helping change their own lives.
It's a cold December morning in Yellowknife. These gifts are being delivered by some unlikely elves.
I'm here to get a present for my daughter.
Oh, you gotta wait till 10.
Michael Fatt leads this group called the Crazy Indians Brotherhood. For a second year, they're giving out toys to families in need, purchased mostly with money raised through donated recycled cans and bottles.
The majority of us come from, some hard backgrounds and some troubled past, Like for myself, I endured a lot of my life.
Fatt is a 60s scoop survivor. When he moved to Yellowknife as an adult, he was homeless, but he got sober and off the streets and found support with the Brotherhood. Mid-pandemic, he came up with the idea for this toy drive.
We know that there's people during the COVID period too, as well as struggling to try to make ends meet. So even myself, and I went through some rough Christmases, and I had socks and underwear, and that was it. And I wish I had the toy, right?
The members of the group collected around $9,000 of recycling from people across the city.
My wife was tired of the bags in my yard.
Then they connected with a toy wholesaler in Alberta. Scott Ewell drove the 1,500 kilometers to Edmonton and back to pick up the goods.
I built my life out of 3 garbage bags of clothes in Yellowknife, and just to see how helpful people are with each other and community-based, for me, I feed off the joy.
These parents have been braving the cold to pick out toys since sunrise.
These are things our kids always ask for that we can never afford.
This mom found exactly what her 2 kids have been asking for this Christmas: a basketball hoop and a game card.
It's tough living off $1,800 a month, but thanks to the community and Crazy Indians and Sally Ann, my kids are gonna have a great Christmas.
All for my kids. I got 6 kids. They just want to open it right now. Oh, put it on that table right there.
Fatt says the gift of giving motivates him to stay sober and grounded.
I'm so grateful for the life that I've created.
He's already thinking about next year's toy drive and expanding to communities across the north. Juanita Taylor, CBC News, Yellowknife.
Next, how a Cree artist was tapped for a very special job.
At first it was like, oh yeah, painting hockey sticks, that sounds pretty cool. But realizing that they're the Player of the Game awards.
Find out more right after this. When Cree artist Jason Carter was skimming his emails earlier this year, he almost missed a once-in-a-lifetime opportunity. Who hasn't missed an important email thinking it was spam? Well, thankfully, Jason opened it, and what happened next is our moment.
I received an email about 6 months ago, and in it, I thought it was a spam email, and in it was someone from Hockey Canada asking me if I'd be interested in creating the Player of the Game awards on painting on hockey sticks. At first, it was like, oh yeah, painting hockey sticks, that sounds pretty cool. But realizing that they're the Player of the Game awards, that 2 players from each of the games are going to be receiving these sticks from all over the world, and and these are elite athletes that have been like, this is the pinnacle of their athleticism to this point in their lives. It's really humbling. Everybody has a relationship with the bear, and what it means, it's this strong, powerful, confident, protective figure. Incorporating the bear, speaking of the Northern Lights, and then exploring the different color palettes of within the season, it all really kind of happened pretty organically. It means a lot to me as an Indigenous man to be able to share my culture and to share my art and know that it's going to go all over the world.
So a bit of a personal backstory. Our team chose the moment, and it wasn't until later I realized I used to work with Jason in the news business in Edmonton many years ago when he was doing artwork and sculpting as a side gig, and now it's a full-time passion. 150 of those hand-painted hockey sticks will be given away as Player of the Game awards and to dignitaries as well. Way to go, Jason. That is The National for December 22nd. I'm Asha Tomlinson. Good night.